Are you a humanitarian or development professional looking to take your skills to the next level? Then our self-paced online courses are perfect for you. We cover all the key areas you need to know, including monitoring, evaluation, accountability, and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition and emergencies, procurement and supply chain management, human nutrition and dietetics, maternal, infant and young child nutrition. Our courses are designed to help you advance your career, stay ahead of the competition, and make a real impact in your field. And the best part is that you can study at your own pace and on your own time. So don't wait. Enroll now and start advancing your skills today.
Diana said this is our webinar for the year 2023, and we are happy to be hosting our first webinar, and thank you so much for attending. So it might be your first time that you're connecting for this series of webinars from Humanitarian Global, and I would like to give you just a brief background information about Humanitarian Global. So Humanitarian Global, we are a training organization that is based in Nairobi, Kenya, with our main focus being to work with both humanitarian and also development professionals and organizations when it comes to capacity building and training. So that is what we focus on. And we are happy to be hosting this webinar on social behavior communication change. It's going to be very informative to you, and we look forward to having a great session. And alongside, besides just covering the aspect of social behavior communication and change, we do also offer other programs when it comes to training and learning. And some of the areas that we do train and take you through, they include monitoring, evaluation, accountability, and learning. We also do water sanitation and hygiene. We also do train on disaster risk reduction and management, food security and nutrition in emergencies. We also do train on procurement and supply chain management, food security and nutrition in emergencies, as I said, and also human nutrition and dietetics, without forgetting maternal, infant, and young child nutrition. So as we go on with the webinar, you might be interested in building your capacity in those areas that I've been able to mention. So always feel free to chat the panelists, and we are going to be there to assist you. So because the time is much gone, I would like now to take this opportunity so that I can welcome the facilitator and the trainer for the day. Her name is Rose. So Rose, if you can hear me, you may proceed and let us know what we have in store for the training webinar for today. So thank you so much. And now over to you, Rose.
Okay, good morning, everyone. I hope all of you have fine this morning, and I hope I'm audible enough. Let me know.
Yes, we can hear you, Rose.
Okay, thank you so much, Anthony, and thank you so much, Humanitarian Global, for this session today, for this webinar. So just kindly allow me to share my screen so that we may be able to proceed. Just give me a second.
Okay, Rose. While we wait for you to share your screen, I'd like to mention to all participants that you're welcome to ask questions in the Q&A section of the webinar. And at the end of Rose's presentation, we'll be able to give you feedback, and we'll be able to welcome participants to ask questions.
I hope you're able to see my screen.
Yes, we can see it now. You may proceed.
Okay, thank you so much, everyone. So today our focus will be on digital transformation in SBCC for health promotion. And the topics or the agenda for today, these are the areas that we're going to cover. We may not be able to cover them exhaustively, so this is more of an introduction really to SBCC, and we'll focus mainly on digital transformation. So we'll look briefly on the concepts of SBCC, and then we'll look at the difference between SBCC and other approaches. We'll also take time to understand the dynamics of health and human behavior. We'll also look at some of the challenges that can be addressed by digital health for SBCC. And finally, we'll look at relevance of SBCC in health programs by looking at some of the successful SBCC or in health and hygiene campaigns. So if you have any question, please feel free to post your question on the Q&A so that we may be able to respond even as we proceed or at the end of the presentation. So before we talk about SBCC, allow me just to talk briefly about communication, and I will also talk about digital transformation before we talk now about SBCC. So in terms of SBCC, SBCC stands for Social Behavior Change Communication, and the key term here is about communication. So let's just have just a view first about what communication is and what really it does in terms of changing or in terms of changing behaviors. So as I've put there, communication really plays a powerful role, and it can be used in addressing barriers, and can also be used to shape demand for promotive and preventive practices related to health. And in terms of communication, for our case today, because our focus will be on health promotion, so much of our focus really will be looking at some of the practices and some of the key behaviors that are related to health. However, communication can be used in many other areas because our topic today is on health, so we may be more focusing on health than other areas. However, communication can be used in all over in other areas really. So in terms of maybe other social, in other social works, it can also be used. So if you look globally at the, how the world is working at the moment, there's a paradigm shift really in how communication is happening. In the past, much of the communication really has been in terms of just a sporadic awareness, just giving information just sporadically to audiences. However, if you look at how the world is going at the moment and how communication is being shaped at the moment, you realize that there's a paradigm shift in terms of how communication is being done, or how messages are being relayed maybe to the intended audience. So if you look at the moment, really, it's more of raising activities, is more on evidence, use of evidence-based strategies, and this is where now SBCC comes in. As we continue this presentation, we'll be able to see how SBCC really has evolved, looking at way back how communication has been done before in relation to health promotion. So why this change, or why this paradigm shift really in terms of how messages are being relayed to the intended audience? So this change has come because of the realization that individual behaviors are influenced by many factors. So initially in the past, we used to have a sender-receiver kind of a way of how we communicate, in that we had maybe, let's say, for example, from practitioners in health, for example. So they would just relay a message to an audience. But however, there's been studies really and evidence that have shown that individual behaviors are influenced by many factors. So behaviors are influenced by culture. They can be also influenced by social norms and also the networks or the environment that people really live in. And we'll be able to look deeper as we proceed in this presentation, how really the dynamics of human behaviors in relation to health. There's also need for mobilization, and when you're supporting a certain behavior, it also comes in with mobilizing communities, which is very much imperative, and also in terms of how we can really holistically change behaviors. As I said before, in terms of digital transformation, if you look at the world at the moment, people are living whether in the developed world or even within the developing countries, people are spending more and more time on digital devices. In terms of ownership of maybe a phone, or maybe a digital phone or a smartphone, currently the ownership for phones really has kept on increasing, particularly among the young persons and adults, both in the emerging and developing economies. I believe even in our countries, wherever we are at the moment, you would find like most young persons really are on mobile phones. Even adults, even within maybe rural setups or peri-urban and the urban setups, you would see that the use of phones or use of digital devices has really increased rapidly. And that's why we are now looking how can we leverage technology really to maybe influence more on behavior change. So in terms of digital transformation, there's now a need for us to look beyond the traditional way on how we communicate messages, and we leverage on technology. So the use of digital devices or digital technology, so for example, mobile phones, computers or tablets, to convey messages it is one of the strategies that may contribute to promoting and adopting and maintaining healthy behaviors. So this is a new area really that we need to think about it, and how can we leverage the use of mobile phones. If our targets, maybe for example, are the young adults at the moment, really most of them are on mobile phones. How can we use these digital technologies to influence their behaviors, and look for a way that these devices really may contribute in terms of how we can maintain healthy behaviors. So this means that digital technologies have a great potential to provide accurate information to individuals when and where they need it. So making information available through digital applications, what it does, it can reduce the time and the costs that are related to receiving information through maybe more traditional sources. As much it's a new area, so it depends really on where your target audiences are. And now that we've had an introduction about communication and digital transformation, let's now think about SBCC. I would like us to just pause for a minute or a second and ask ourselves, for example, what if you could make a simple change right now that can improve your health or your family's health for years to come? Just think about any simple change that you think that you can make that can improve your health or your family's health for years to come. Maybe, for example, maybe eating right, maybe taking, maybe exercising, or maybe just maybe stop smoking. Just think about what if you could make that simple change. So that simple change, sometimes really that change is not that simple. One of the reasons is because sometimes we live in an environment where we have networks, we have peers, we live within an environment, and maybe that change that you would wish to make sometimes may be negative, in that you may be the only one maybe who is making that change, yet everyone else in where you are living is doing the opposite. So making change sometimes is not very simple. So as much as a simple change can really improve your health, so this change can sometimes not be very simple. What could be the reason that change is not that simple? There are many reasons that people give, or many reasons why people do not change behavior. There may be around maybe 100 reasons, but I just picked up few. So sometimes people do not change behaviors because maybe the message that is relayed to them, people do not understand it. Sometimes people do not change behaviors because sometimes people see themselves as not vulnerable. So someone looks at herself or himself in terms of vulnerability, in terms maybe of that behavior. So let's say, for example, maybe we want people to stop smoking, for example. So someone says that maybe they're not likely maybe to develop lung cancer, for example. So someone sees themselves as like, in a pool of 1,000, really, maybe I'm not very vulnerable, and maybe I'm not at risk really, maybe of developing maybe lung cancer. So an individual may see themselves as not being vulnerable, so maybe they do not change the behavior. Sometimes people are prepared maybe to take risks and maybe deal with the consequences later. So sometimes people maybe sometimes, for example, maybe in terms of maybe maybe want people to stop smoking, or sometimes we are dealing with young persons in terms of SRH. So sometimes they take risks and they would be like, maybe I will deal with the consequences later. Sometimes people do not change behavior because they feel like life is already hard, really. Maybe one more risk does not make much difference in my life. So sometimes behaviors also are not necessarily based on rational thought, but sometimes it's because of the environment that people live in. So I know there are many, many other reasons that people really give in terms of why they do not change behaviors. And we will look at some of these with real examples even as we proceed. Let's just look at an example. For example, some of us who have been in the field of maybe water sanitation and hygiene, those who have been in COVID prevention, those who have been in nutrition, or any other health program, we all know about hand washing. It's a practice that we've really tried to promote over and over. So sometimes why do people really do not want to adopt maybe hand washing as a practice? So everybody knows that hand washing can prevent diarrhea and other illnesses. So, but you find that most people still do not wash their hands at critical times. So it could be because that most of the time, people do not get sick of this diarrhea that we talk about. So they discount the significance of this, what we call the punishment that we talk about in terms of getting diarrhea. So another example that has been, which is I know most of us can relate with, is in terms of COVID-19. This was a pandemic that hit many, like the whole world. And in terms of wearing masks and vaccination, most countries really have struggled in terms of making people to mask up. And some of the reasons people were giving us what we talked about. Some people felt like maybe they're not vulnerable. They felt like maybe in a sample of 1 million, maybe I would not be one of them who would get COVID-19. So that's some of the reasons that people really give in terms of why they do not want to adopt behaviors. And so that's why the use of SBCC really comes in at such points. So why do we talk about SBCC? So how do we get individuals? How do we get communities? How do we get countries to change maybe a certain behavior? With that, we all need what we call SBCC. So SBCC, as we said, is social behavior change communication. And in simple terms, SBCC uses the power of communication to change behaviors. And it goes beyond the delivery of simple messages or slogans. So when you look at SBCC, it's not just about maybe an advert on TV or maybe a poster somewhere or just a slogan, but it looks at a full range of ways in which people individually and collectively convey meaning to a message. So in terms of how the tools are employed in SBCC, so it looks at leveraging many maybe channels of communication. So it looks at maybe, for example, using mass media, community level activities, interpersonal communication, and maybe communication technologies and new media. And that's why we were talking about how can we leverage the use of digital devices and digital transformation in terms of how we relay our messages. So SBCC, as we've said, it's power of communication, but it goes beyond just simply a message or maybe a slogan or maybe a TV advert. So why SBCC? So I'll talk about three characteristics of SBCC on why we really promote SBCC in health promotion. So it's a systematic process. So in that it ensures messages and methods are grounded in data. So SBCC, it's a whole process where you really do what we call an analysis of the problem. Before now you come up with a message to address the problem. So it's basically grounded in data. You need evidence to be able to develop a very good SBCC campaign. Why SBCC? In that it's grounded on in data and on the social context and target audience. So I was giving an example, like if you're targeting youth, maybe you're working in an SRH program that you're targeting youth, maybe you're looking at maybe HIV/AIDS or maybe something on contraceptive use. So you need to know who are your target audience. So you need to segment or profile your audience. So you would be like, look at it in terms of, for example, the target audience maybe are based in a rural setup, or are they based in a peri-urban area, or are they in an urban setup? So you'd also want to know what is the age group. You'll also want to know what is their daily routine, for example. Another example I would give, for example, if your target audience, for example, is maybe you're looking at women. So you may want to know these women as my target audience. Are they women of childbearing age? Are they older women? Are they very young women? Or are they women maybe who are newly married? So you need to be very specific in terms of target audience, so that you do not give out a blanket message. So the message should be able to reach your intended audience. So another characteristic why we're promoting SBCC is that it uses what we call mutually reinforcing communication channels. So mutually reinforcing channels in that you can decide to use maybe, for example, mass media, and you reinforce it, for example, maybe with IPC, interpersonal communication. So you use more than one method of communication to be able to trigger change. So another reason why we promote SBCC is that it also has other activities within it. And the key ones I would say is in terms of mobilization, community mobilization, and also capacity building. So it's a whole range really of activities, and the approach is very wide and comprehensive, and that's why it's able really to bring the intended change. So that's why we say SBCC works. I think as we wait for you, I would hand over to Ken to just give us a brief in terms of what are the differences in terms of the SBCC and the other approaches that we've been using in health over time. So over to you, Ken.
Okay, thank you, Rose. So Ken will not be able to make a live presentation. However, Anthony will be able to share what he had prepared for us. So Anthony, over to you.
Thank you so much, Diana and Rose. So maybe just to confirm for me, Diana, you may let me know whether you can see my screen.
Yes, I'm able to see your screen.
You can see the presentation?
Yes, yes.
Okay, that's okay. So I would like to play a voice note and also a presentation from Kenneth. So maybe also you can confirm whether you can get the audio once I click on play.
Good morning. My name is Kenneth Huor, and today I'll be talking about the difference between SBCC and other approaches. Social behavior change is a dynamic chapter, and it uses various influencers in the environment and in the society where an individual lives to create an enabling environment for change of that particular individual. So in this matter, SBCC uses social contexts, systems and structures to create that particular environment, and that will promote a situation where that particular individual in that environment will make a decision to change. Some of the differences include SBCC is holistic in nature. It brings about holistic change in an individual while focusing the community and the society where that individual is. While that of other approaches focuses on the individual alone, it doesn't cover what is happening in that community and the society. Other approaches assume that behavior change comes from acquiring knowledge and effecting that particular knowledge. So once people are trained, they acquire that knowledge and make practice or make use of that particular information. While that of SBCC is more holistic. It recognizes that behavior change is not just getting that information and making a personal choice out of it. Rather, the community and other influencers are involved during decision-making time. Other approaches focus on knowledge, attitude, and behavior, while SBCC is much more broad. It looks at various norms, social contexts, it looks at knowledge and attitude, beliefs, behaviors, and the environment itself. Other approaches focus on teaching information and telling people what to do with that bit of information and showing them how they should behave. While SBCC is unique, it uses various platforms to communicate change, hence making beneficiaries or individuals to make private decisions on how to behave. So the behavior in this context is influenced by the influencers in the environment, what people see in the environment that will make them to change, and not just using the information to make personal decision to change. Thank you and have a good day.
Okay, thank you so much. That is a voice note from Kenneth talking about SBCC. And now over to you, Diana, with the presentation slides, and back to you, Rose.
Okay, thank you so much. I think that's where we are. Okay, so in summary, as we've heard from Ken, I'll just pick 3 points from what he's talked about. In that before, in other approaches, we've been talking about providing people with information, but telling people really how they should behave is not enough to bring the change. Let me just give a random example. information is not enough. So let's say, for example, consider your own behavior. So even though you know fresh vegetables are healthy to eat, do you really always eat them? So you know that eating fresh vegetables is really healthy, but do you eat them? So it's so providing people with information is not enough. So while providing information is helpful, SBCC recognizes that behavior is not only a matter of having information, but it also requires what you call a supportive environment. As as Ken has talked about, it says that these individuals that we are targeting, this person lives in an environment. They are influenced by maybe the peers, maybe the community, the household, and also a supportive environment in terms of maybe the policy that country really does not support maybe good nutrition, for example. So the policy environment also influences that behavior. So the community and the society that people live really supports and are necessary for behavior change. As you said before, like why don't people change behavior? There are many factors that influence behavior change. And so I'm going to give about 5 reasons or five facts about human behavior that show that behavior is influenced by many factors, which be context-based, or maybe because of where we live in, and also maybe because of the environment that people live in. So the first one is that people give meaning to information based on the context in which they live in. So people are able to give meaning to any information that we give out based on the context that we live in. So let's say, for example, I'm going to give an example in maybe where you're promoting maybe contraceptive use among women. So you'd find that, for example, a married woman maybe with 3 children may be more receptive to family planning information than someone who is newly married or who does not yet have children. So people give meaning to information based on the context. So when you're giving information, that's what we talked about. The context that people live in really influence their behaviors and how they give meaning to any information that they receive. So it's based on the context. The second one is that culture and networks influence people's behavior. So the cultures that people live in really influence their behavior. So still on contraceptive use, because this is more common, I know in many countries. So for example, if we are promoting contraceptive use among women, for example, so the knowledge about contraceptive use or contraceptive knowledge is somehow, I would say somehow universal, but their uses are different, or their adoption is different, or taking up contraceptive use are different. And some of them are really based on religion. Some also are based on the culture where people live in. So you'd find, for example, maybe women maybe who live in a rural setup, because of their culture, the networks and the people that influence them, maybe the household, maybe that they live in, may influence on whether to take up the contraceptive use or not. So culture and network influences people's behavior. And so this is not only in terms of contraceptive use, but in other behaviors that we try to promote. The third one is that people cannot always control the issues that determine their behavior. So sometimes maybe a woman, for example, may not be able to plan and space her pregnancies if her husband does not support the use of contraception. I think this is something that all of us know, whether you're in the health field, is that sometimes the woman may not have control on the behavior, or maybe that uptake of that maybe contraceptive use, for example, because the environment that she lives in, maybe the husband may not support the use of contraception. So people cannot always control some of the issues that determine their behaviors because of influence from the environment that they live in. Okay, another dynamic really is about people's decisions, how people decide about their health and well-being, in that people live in an environment with competing priorities. I think this is very common, particularly in those of us, maybe for the participants, for example, who are working maybe in smoke. I mean, like if you want people maybe to stop smoking, for example. So if you are targeting men, so sometimes men who smoke and drink may know these practices are harmful. They know that smoking and excessive drinking are harmful to their health. But sometimes they do not change. Why? because they know, like if you are a man who smokes or who drinks, maybe, you know, you are in another level among your peers. So sometimes the peer pressure, the pressure to be seen as a real man may override the health considerations for these individuals. So sometimes when we are talking and thinking about how people make decisions about their health, there are other competing priorities. People want to be seen maybe to belong to a certain group. People want to be seen to maybe belong to a certain maybe cadre or a certain level in the society. So even when dealing with young people, for example, sometimes young people want to be seen as maybe belonging to a certain group. So there are usually many other competing priorities really that also determine how people take up maybe health messages. So another factor is that people often make decisions based on emotional factors and not logic. So sometimes, maybe for example, a woman may have had so many children, closely as spaced pregnancies, for example. But sometimes her desire to get a male child, she will keep on trying to achieve that goal. So it is based on emotions, not really the logic. So the logic for us maybe in health would be like, the woman needs to have spaced pregnancies, or maybe she needs to have maybe about 4 children and maybe to stop. But the fact that she desires maybe to have a male child for the family will keep her she will keep trying to get pregnant more until maybe she gets that child. So people sometimes make decisions based on emotions and not logic. As health professionals, most of the time, we usually base it on logic, on why maybe you need to have this, and maybe you need to adopt such a behavior. But sometimes we need to understand that the decisions that people make, they're based on emotions. So like, for example, this woman in a household, she needs to get maybe a male child for the family. So she will continue having a closed spaced pregnancies at the expense maybe of her health. The evolution, how SBCC came into really, is that as we've seen, the dynamics of human behavior has really shaped the evolution of IEC to SBCC. So it has evolved from just giving information in terms of IEC and health education. And as you can see from this photo, is that in the past, really, we've been talking about just having a sender receive a message. So the sender just sends the information to the receiver without considering how this person will receive the message. So SBCC, so this evolution from IEC to SBCC. So from IEC, it came to what we call BCC. So this is behavior change communication. And as my colleague had talked about, BCC focuses mostly at an individual level. So it looks at knowledge, attitudes, and practices, but it focuses on an individual. Looks at an individual, but the focus at the moment is on SBCC. So SBCC is more of a comprehensive approach. So in summary, we can say that SBCC is systematic, and it applies interactive. It also applies a theory-based and research-driven communication process. So it looks at, it addresses changes at individual, at community, and at societal levels. So in terms of social change, it includes changes maybe in social order, in terms of social norms, social behaviors, and in terms of behavior change, it looks in terms of changes in human behavior. Okay, so just in summary, what we can say about having an effective SBCC program, as we had said before. So the first one is that it uses multiple SBCC approaches. So it's not just one approach. As we say, we need to use what we call mutually reinforcing approaches. So it is, for example, you can use interpersonal, where you have a counseling visit. And this one you can augment with a community radio or a social media approach, which is more effective than using one approach alone. So that is one of the key aspects of SBCC. SBCC also, the second point is that it is context specific. And so, for example, you need to design a message and also use a channel that resonates with your audience. So for example, if your target is primary caregivers, maybe for children, or maybe your target would be husbands only, or maybe your target would be maybe youth, or maybe school-going children. So they are very context specific. So SBCC is more stronger when you combine activities and channels designed to resonate with specific audiences. So this one also, you ensure that what you are conveying appeals to their core cultural values. So a message, for example, that you're targeting maybe for youth who live in an urban setup may not be appealing for youth maybe who live in a rural setup. So it has to be very context specific. So the third aspect is that it is effective when targeted messages are reach the intended audience more than once. So it's not about just giving one message maybe at one time, but you need to do what we call more exposure. So when you expose someone to the same message over time, there's likelihood that there will be a behavior change. So these are some of the key aspects of SBCC. These are the three key aspects of SBCC. And at that, I think I would welcome one of our guests to tell us some of the challenges that can be addressed by digital health for SBCC. Thanks so much, and I think I'll hand over to Lucy.
Thank you, Rose. Now we'd like to welcome Lucy, who's a WASH expert, and she'll be able to take us through the next session. Lucy.
Good morning to everybody.
Good morning, Lucy. We can hear you.
Oh, great. Thank you. So I'm Lucy. I work in the WASH sector. So I just want to share some challenges that can be addressed. Let me go straight forward to the challenges. The challenges that can be addressed by digital health, most of the time, we can just say, like, for instance, the challenges related to taboo, cultural, and religious beliefs, background, and individual perception. For instance, if we can just give an example, like people may be having a certain kind of perception on a certain health behavior that we want them to adopt. For instance, if it's like the youth that we are dealing with SRH, the sexual reproductive health, the teens may be having a lot of rumors, they may be having a lot of beliefs, they may be having a lot of, if I can say, like kind of misinformation. But and most of the time, they are not even feeling comfortable to seek for information to the right health personnel, like the healthcare providers. Most of the teens, they just fear to express their thoughts and what they want to really understand about the health, their reproductive health. But when we just adopt the digital health, it can help to disseminate the information within our target group in an easy way. So I think the challenges related to cultural and beliefs and background, digital health can really help in that kind of manner. Other challenges that can be addressed by digital health include like social and economical constraints. People may not be having a lot of money to invest in trainings to gain knowledge in relation to health. They may be just lacking some capacities to invest, to go for trainings. But when they can go to internet, they can go to e-learning centers to get information on a certain kind of best health practice that we may want them to adopt. Other challenges are related to illiteracy. Digital health can even help people who don't know how to read or to write. There are some best practices, the health-related best practices that we can even illustrate in terms of images, in terms of, we can even use brochures where we just put the images to express what we want them to adopt. If it's hand washing, we can even disseminate that health message using even images. So even those people who don't know how to read and write, they can even just see images and then they just acquire the information. Other challenges are related to time. time I can even combine it with accessibility to another, to the below slide, where the digital health can help to access a lot of people within a few time. Like you have seen during COVID pandemic, where some countries even used helicopters just to go to disseminate the health messages in relation to COVID-19 prevention. So digital health can really address the challenges related to time, related to the coverage. The message can reach a lot of a huge coverage where people are found or where people are located. It can also address people, the mobile populations, those people who we cannot go when we, like health professionals, going into outreaches. So it's when you just see the mobile people, it's very difficult for them to plan for health campaigns, where we can just organize the campaign, the outreach. But when we just adopt this health, digital health in SBCC, it can help because they can even get the messages through their mobile phones, through the televisions, and whatever. Also, it can also work on the, if I can say, a lack of trust. Most of the people, they are lacking trust to like some healthcare providers. But when they just read, they go through internet, they just use their mobile phones, or some applications, or some other technological means, they can access healthy messages, and that can be very, really helpful. Also, I have just talked about the rumors and the misinformation. I talked those are some challenges that can be alleviated using digital health in SBCC. Another challenge that can be addressed is the shortage and the scarcity of human resources. This means healthcare providers. You know, in our countries, most of the developing countries are just facing this challenge. So it's very difficult for health professionals to go in rural areas, in remote areas, just to meet people and disseminate health messages. But with digital health, we can just work on this challenge. Even accessibility, I have talked about it, accessibility in remote areas, in difficult topography, where people live. It's very difficult to reach them, but we're using digital health in SBCC, it can help us to promote health. Thank you.
Thank you, Lucy, for that very informative presentation. I will now hand over back to Rose to continue with her presentation, and I will be sharing my screen on Rose's behalf.
Okay. Thank you so much, Diana, and thanks so much, Lucy, for that key presentation really on how we can leverage on technology and as we're doing SBCC work. I think so finally, this is so as we end our discussion this morning, or this afternoon, let's look at if SBCC is really relevant in health programs, and then we can look at some of the examples, maybe in the field of health, in the field of WASH, and just a few examples to show that really SBCC works. And so SBCC is critical in terms of improving health and also in terms of behavioral outcomes. And so it can be used in many ways in terms of increasing uptake for services. It can also be used to improve consistent and long-term maintenance of behaviors. So I just give like 3 examples. So SBCC can be used to get clients to services. I think as Lucy has talked about this afternoon, that we can target clients, or we can target participants, or it depends on the group that you are working in. For example, if we are working with pregnant women, for example, and we want them maybe to use services within the facility, maybe for example for skilled birth, so we can use SBCC to get them to the service. So that means we are able to create demand among the people that we are targeting to be able to get into a service. So that is one way in which SBCC can work. So it can also work beyond just the demand or looking at the clients. We can also use SBCC to enhance what we call client experience. So client experience is that as we have got, maybe for example, we have targeted this pregnant woman and we have influenced her maybe to come to a facility. So we also need to work with the service providers to ensure that the clients are getting good experiences, so that the behaviors or the new behaviors that have been adopted, they are supposed to be improved when we provide services at the provider level. So it is just a continuum from the client and also maybe from the provider. So the providers for us, maybe for example in health, would be looking at maybe from a health facility, for example. It could be also maybe from healthcare workers. So we are not only focusing on the clients, but SBCC also can focus on maybe service providers. So SBCC can also support follow-up of behaviors. So we are looking at how can we maintain linkages between the communities and the service providers, so that now we have a sustained demand. We can have a sustained mode in which the behaviors, the new behaviors that we have developed are able to be sustained over time. So SBCC is very relevant. So in many health programs, so depending on the area that you're working in, you can look at it from the client all the way to the service provider and how this can be maintained over time. Okay, so just these are just a few examples. For example, so you can use SBCC maybe to modify a current behaviors. For example, so a current behavior, for example, is maybe on hand washing, but you can use also SBCC maybe to modify, because what people we can use what we call nudges, maybe so that people can wash hands more frequently. We can also use SBCC maybe if you're running a nutrition program, for example, so you can support households, for example, in terms of how to make informed choices when they are maybe in the market and maybe they're buying foods, so that they may be able to buy more nutritious food choices in the market. Because sometimes you'd find that people maybe would like to buy more refined foods, for example, as opposed to maybe more nutritious foods. We can use SBCC to be able to change that behavior, or maybe want households maybe to adopt maybe improved infant feeding practices. So we can also use SBCC, as I've said, when we're targeting maybe community health workers. We work with community health workers in most of our programs, and we can use SBCC to target these health care workers, because they're the ones who we use to convey messages, and maybe also in terms of whether it's a health message, a hygiene message, or any other message that we're trying to convey. And so as we move to the next, I would ask Anita to just give us some of the examples of health campaigns, or maybe just an example of hygiene campaigns that are from her own experience. Thank you.
Okay, thank you so much, Rose, for that. I will hand over to Anita. Anita, are you with us? Okay, thank you so much for joining. So Anita is also another WASH expert, and she'll be sharing her screen with us. So over to you, Anita.
Thank you. All right, so what we normally do when it comes to promoting health promotion in a community, we try hard to see how best we can understand the attitude and the behavior of people that we want to help and address their health issues. So what happened in this case, we work with a group called the Water User Committee, who is there to take lead of activities in the absence of NGO with less supervision. So what we normally do is to encourage them using this proverb that if you tell a person to do this thing, they will forget. If you show them, somehow they will remember. But if you get them involved in the process, they will understand how to go about doing that activity. They will also reflect on the benefits, looking at the negative benefit and the positive benefit, and learn how to adapt, and that will help them to contribute towards the activity. So this activity this program helps our work to make those people we are talking to learn, not in a shallow way, but with deep understanding. So what we do in this case is that our objectives that we set regarding the committee that we are using is that it should be SMART, wherein we will focus on their existing knowledge, how we can improve on their existing knowledge, and making them to have that right attitude to act to achieve what we hope to achieve. We also observe that if you use the right approaches in addressing the concern, it helps. Remember, in adult learning, there's a learning skills that help people to immediately grab, which has to do with pictorial flyers. By using flyers, some people who don't know how to read, they will be able to understand what exactly you are talking. And we also use a group session wherein we get feedbacks from people to give their points regarding the issues. And with that approach, we observe that more of the water user committees that we were helping to help their communities in the absence of NGO were able to adapt and take actions in order to solve their own issues. And we noticed that in our sessions when we were talking with them, not everybody that you see reading can understand, and not everybody that you see can read. So what we decided to understand what we call their instant response tools, looking at those that immediately can grab based on a response, those that can immediately take in, how can we engage them, which is to follow up on them, and we also look at those that already accept and willing to take action. So in this case, we try our possible best to help them improve their watch habits and also help them to record those good practices that will help them to continue sustaining the facilities or the actions that they are carrying on. So what we do in this case is that we create activities, mini activities, like coaching session. We have coaching session, one-on-one coaching session with the group, practical experience, considering them we carry them in the field and do some demonstrations that will make them to reflect when they are doing their own work in the absence of us. And we also not focus on education base, but we focus on a learning center where we see that behavior change takes lead and then they try to adapt and fit in whatever activities they are doing. That followed by the interactive learning process. We believe that the people that we were dealing with, they already have that understanding, but we just need to build on them. So in that session, we try to trigger their actions, to trigger their thinking ability, to see how best they can come up with their own solutions. So as a result of that solutions, they were able now to demonstrate, they were able now to find their own group session to do the activities, and they were able to reflect on all the good things they were doing and how, if they were not to do it, how it was going to cause trouble for their community and for their own selves. So at the end of this activity, we found out that those water user committees that we were training or were helping to build a capacity, not just education focus, but that to lead them in a behavior change aspect, they were now taking lead, visiting the community's dwellers, doing house-to-house visit, and they were also able to draw key indicators. They consider it as a mini survey wherein they will track the activities of each household, how they respond to, for example, if the safe water management, how they will take care of the water at the household level, those processes, and how they can involve their own children in the process so that it can be sustainable. Thank you ever so much.
Thank you, Anita. That was quite informative. We will then proceed with Rose, who will be closing up our presentations. So Rose, let me cast the screen for you.
Okay, thank you so much. And thanks so much, Anita, for giving us a practical example from the work that you're doing. And so just to wrap up our session this afternoon, I'm just going to highlight some examples of where SBCC has been done before. These are just, I picked some of the examples, and I think you can go and look at more deeply into them. So I'm not sure if you can see them very clearly. But the first example really is about Uganda. It's from Uganda. So Uganda, the first one is about Uganda. So in Uganda, they had something called Uganda Communication for Health Communities. So what they did in this program is that they integrated SBCC approach. So they capitalized on a popular brand. So this is how they looked at it. And they capitalized on a popular brand and a national campaign to spur dialogue on healthy behaviors. So the behaviors that we were looking at in terms of the services, what they're looking at in terms of HIV, in HIV, and also in total fertility and MNTH, as well as malaria and TB. So it was a more comprehensive program. And if you have time, you can look at it. So another example is from an organization I think most of you are aware about. It's called Alive and Thrive. So Alive and Thrive is an organization that focuses on nutrition and to ensure that it's on breastfeeding and infant and young child feeding programs. So Alive and Thrive, it combines media, social franchising, and it's a personal communication to promote the adoption of desired behaviors and changes in social norms related to nutrition. And you can look at that website and learn more on how Alive and Thrive is really using the power of SBCC. The third one is from Ghana. So it's called Ghana Communication for Health Project. So it collaborates with the Ghana Health Services to bolster their ability to develop SBCC campaign. So their focus is on family planning, nutrition, maternal and child health, malaria, HIV, AIDS, and WASH. And so it is, they also use the power of radio and TV and social media. The last one is on WASH. It's from WASH Plus. So WASH Plus uses integrated and at-scale SBC approaches to improve health outcomes related to water, sanitation, and hygiene. So these are just a few examples on really why we are now promoting SBCC and that SBCC can bring change. So thanks so much, everyone. I think that should be my last slide for the day. Back to you, Diana.
Thank you so much, Rose. Sorry. I believe we do have some questions in the Q&A section, as well as participants have been able to send in questions. I believe, Rose, you can look at some of the questions and answer them.
Okay, thank you so much. I think I've typed in some of the answers really, but the ones that I picked is that someone was asking if we can use SBCC in other programs. Okay, so as I indicated when I was beginning this presentation, our focus maybe today was on health, but SBCC has been applied in other areas. So for those who are working in education, you can use SBCC. If you're working in places, maybe you're working programs in agriculture or food security, if you're working maybe in nutrition. So SBCC is an approach that can be applied in many sectors, not just in health. It's only that our focus today was on health. That was what we are giving examples in relation to health, but it can be used in other programs. There was also a question where someone was asking the difference between SBCC and IEC. I would say that, as I said before, SBCC evolved from IEC. So IEC, if you look at it keenly, is an approach that we had been using it in the past, but it is more of a one-way communication. It was one of a mode of one-way communication, and it was assuming that people would follow the health advice that we provide. We assumed that we are providing the right information, that with the right information that we are providing, people would change. But if you look at SBCC or BCC, we are now involving and want to understand what is the need of this person, what is really influences the change from the individual. So it's more of a two-way. When you're designing a message, you are designing with the mind of the user or the audience at heart. So in your mind, when you're designing SBCC, you are also looking at who is my intended audience, what do they need? How is the environment that they're living in? So that is a key difference between IEC now and when we talk about SBCC. Thank you. Let me, okay, so, okay, thank you so much. I think I've answered the questions that were in the Q&A. Over to you, Diana.
Thank you so much, Rose. As we wait for Diana, at this moment, I would also want to open the floor. In case you have a question, you may raise your hand and then I will be able to unmute your microphone, and then you can pose your question. So in case you have a question, you can raise your hand, and then we can be able to give you the chance to ask your question, and we can respond to you. You may also be having some comments concerning the session. We are also welcoming you. Raise your hand, and we can be able to hear from you. So as we wait for your request for you to ask your question, I would like also now to invite Diana, who can give us a brief about the upcoming training and how you can be able to be part of that training. And then I would be able to proceed and take you through the community so that you can get to know how you can continue with more interactions with other professionals and our team here when it comes to matters to do with humanitarian and also development work. So back to you, Diana.
Thank you very much, Anthony. I'm sorry, I missed quite a huge part of your speech. Unfortunately, I lost network, but I'm back now. Kindly repeat your last point.
Okay, sorry about that. So we are waiting for participants to pose their questions. I can see we have one hand up. So maybe after the questions, you can be able to take us through on the upcoming event so that we can get to know what is going to be covered and how someone can participate for that event. As you get ready with that, I would like to invite, I can see Masego Champion. So Masego, you can proceed and ask your question or maybe give us your comments.
All right. I have, I think, 2 questions. I wanted to know, do we have an example of an effective SBCC project done at like by the government? You know, looking at my experience as a government employee, I think one of the gaps that we are having as health promoters is lack of sustainability in delivery of services. And I believe this model could work best for us. But looking at the resources that we are having most of the time, there is just that lack of sustainability. So I just want to know how effective or whether we have some of the examples that we can show or you can name whereby this was used maybe at national level or ministry level. Number 2, in case of responses or emergencies, let me say, because most of the time in some of the emergencies, for example, like COVID, we are in an emergency situation. How is the SBCC approach that much effective looking at the situation, more especially COVID?
Okay, thank you so much, Masego, for that question. So over to you, Rose, as you give us some responses to that.
Thanks so much for your question. I'll begin from the second one in terms of use of SBCC in emergencies. I think it's an COVID-19, for example, has been like an emergency or a pandemic. And I've seen most programs really have tried in terms of reaching people in terms of behavior change when it comes to maybe taking, for example, the current campaigns really are in terms of vaccination. So SBCC has also been applied in emergency setups. And I think the perfect example that you've given is in terms of COVID. I think governments really have tried, but in terms of how to reach populations to change behavior in regards, for example, in adopting and embracing vaccination, which I think it's been a hurdle for many. But I think in terms of adopting SBCC, I think it's one SBCC has been really helpful in reaching out to the population. And I think for most governments, as we say, it's in terms of really getting the resources. And I know that for most governments in Africa, they've been really depending on support from partners in how to reach people in terms of maybe messaging. And I would say that I know in terms of sustainability, it's a challenge across board. And I think that's where partners really come in how really can we work with the governments and how to sustain some of these behaviors. I would give an example in terms of, if you look at HIV and AIDS in the past, how it was, the messaging, how it was rolled. And if you look at it now, over time, I think when the approach was changed on how to reach people really in terms of how to go for testing or how to embrace maybe taking their medication, I think the approach currently really has the message has reached home, I would say. So that you would see the use of SBCC in, I was reading somewhere in that the use of SBCC has really helped in terms of improving lives, and also in terms of really lowering mortality rates, maybe from HIV and AIDS. Maybe I will look for that article and share later, in that it reduced maybe by a certain percentage. So it shows the power of SBCC. But as you said, by the way, I think it's a challenge overboard, across the board in terms of really resources. I know resources are limited for governments. Those are also limited even from development partners. But I know the might that have been done in terms of how we transform behaviors through SBCC is really evident. If you look also in terms of SRH, in terms of condom use, for example, and also in terms of self-testing for HIV and AIDS, I think the use of SBCC has really improved. So there's been improvement in terms of well-being of populations. There've been less mortalities from some of the maybe ailments or diseases that we are really trying to target. Thank you so much.
Thank you so much, Rose. And for Maseko, I hope that has been quite informative in regard to your questions.
All right, thank you so much. Thank you, Rose.
Okay, thank you so much. So in case you have a question, don't forget that you can raise your hand, and then I'll be able to unmute you, and then you can pose your question. So you can also give us your feedback, your comments. In case you have inquiries, you can also continue and make sure that you can let us know what you have. So thank you so much. And with that said, maybe Diana, as we wait for maybe someone else who has a question. Okay, sorry, Diana, just keep it on hold. Let's hear from Joyce Loser. Hi, Joyce. We can hear you. You can unmute and then pose your question.
Yes, Anthony. Hello, everyone. Thank you very much for those enlightening presentations. We really appreciate the empowerment that you are bringing into us. So I've been wondering, I really see these presentations as very good. And now I'm thinking of my colleagues back at work. So I'm wondering, what are the opportunities out there? How can you assist us, more especially as government employees who have basic training on health promotion? How can you help us bridge this gap? Because I can see this presentation that you've just made. My colleagues can also benefit from them. So I'm wondering, how can you reach out to us as the entire health promotion profession? Thank you very much.
Okay, thank you so much, Joyce, for that question. And indeed, at Humanitarian Global, we endeavor to ensure that we can support you when it comes to access to information. And information is power, as we always say. And with that in mind, we do have a detailed training workshop that is coming in the next few days, 10 days from now. We have been able to share more details in the chat section, and you can always ensure that you can be part of that event by registering. So we have been able to support other organizations in the same, in terms of training and building the capacity of their team, so that as we go out there to serve the society and our communities, we can have the proper knowledge and information, so that we can drive these kind of campaigns and also dissemination of message. So Diana would be sharing more details in regard to that. And maybe Diana, it's a good chance for you to be able to let us know what we would be expecting when it comes to the SBCC detailed training workshop.
Thank you very much, Anthony. So as you mentioned, we have in 10 days an upcoming training on social and behavior change communication, that is SBCC in short. And this training will be held from the 21st to 23rd of February, 2023. It will be via Zoom. It will not be an in-person training. This is an online training. And the 3 days you'll be expected to have a training of approximately 3 to 4 hours for the 3 days, obviously with breaks in between. And the reason for this training is to provide the participants with practical skill sets required to apply effective communication techniques to change behaviors and promote social change. This is through influencing language, attitudes, and social norms. So I think we can mention that this training is not specifically for experts or people in the WASH field or in the humanitarian field. It could be a training for people who also need to learn more about SBCC, who need to start up a career in the humanitarian world or field. And for this, the reason why I mentioned that is because part of the objectives of this training will be to introduce and give an understanding of key factors of human behavior and SBCC strategies, and principles for essential communication planning. Something else that the participants will be able to acquire from this training is an improved understanding of communication strategies and channels for facilitating sustained behavioral change, as well as the participants will be able to effectively monitor and evaluate SBCC campaigns. So this training also targets people who are already in the monitoring and evaluation field. The 3 days will be structured as such. So the first day we will have an introduction to SBCC. And like I mentioned, this is a very in-depth training. So even if you're not really conversant with SBCC, this training is also for you because you'll get an in-depth introduction into concepts and principles of SBCC. And then followed by the focus, design, and creating of messages through C planning process. And then the third day, you'll be able to practice and see how monitoring and evaluation is implemented in the C planning process of SBCC. So like I mentioned, it's a very in-depth training. And from this, you'll be able to acquire very practical skills in SBCC. It's a very technical training. However, do not shy away from it because as I mentioned, if you're not very conversant with SBCC, we'll be able to take you through the process. We'll be able to introduce you to the process all the way to monitoring and evaluating of SBCC programs. So I do welcome all participants to attend. Our registration deadline is on 13th of February. I don't know if Anthony would be able to extend it for you, but it's very important that you try and register before then. Thank you so much. And Anthony, back to you.
Okay, and thank you so much, Diana, for that information concerning how one can be part of the training workshop that is going to happen for 3 days, a very detailed training, and we look forward to having you join. And also try to also invite your colleagues, your staff members, your friends, your network, so that they can also get to be aware of the event and follow up with the registration process. So I can see we don't have any other participant with a comment or a question. So as we wind up the session, it is also good to know that Humanitarian Global, in addition to supporting you when it comes to capacity building and training, we do also ensure that we can connect you as humanitarians and drive conversations on how we can better ourselves. As you can see from the mode of presentation, even amongst ourselves, we have a lot that we can share with each other. So in that regard, Humanitarian Global has been able to come up with a way on how we can communicate, have vibrant conversations in regard to humanitarian and development issues and topics. And that is what I would like to take you through just in the next 5 minutes before we can wind up. So this is on how you can be part of the Humanitarian Global Wave. And this is to ensure that we can always be in touch with you. In case you have a question, you can post it there and we can respond to you. So as I take you through, I would like to share my screen. And I do believe that by now you might have been able to get a link in the chat section. And that is on how you can register and be part of the Humanitarian Global platform. And this is a community forum. So maybe for Diana, you can confirm for me which screen you can see. Just a moment so that I can ensure I'm in the right screen. So that is what I want to do. Just a moment as I try to do that. Okay, great. So maybe Diana, you can confirm which screen you can see. It's supposed to be the Discord.
Yes, I can see the Discord screen.
Okay, that's okay. So we have been sharing a link with you on the chat section. So this is for you to join so that you can even be, we can be communicating amongst ourselves. We can be providing answers and responses to you in regard to the kind of work that you're doing and also getting support. So in that regard, what you're required to do, there's a link that we shared. So you just have to click on that link. You're going to be redirected to this website here. And all you have to do is for you to click on continue. So once you do that, you would be required to sign up. So for you to have an account, you just need to have an email. So you need to ensure that you can use your email address to register, then set up a password that you can easily be able to remember. And then you can log in. So for you, because you don't have an account yet, you need to click on register. So register is going to populate and give you this kind of a form. So this is where you type your email, and then for your username, you can choose a name, maybe one of your name, that would be okay. And then you can be able to fill this form, and then you can confirm and then create an account. So I'm happy to see that most of us have been able to do that. So once you have created an account, you'd be able to come and log in using the same details. So allow me to share another screen so that I can show you how it will be able to display on your end. This is what I want to share. So yeah, so maybe Diana, you can also confirm whether you can see my logged in screen, just to ensure that we are on the same screen. Okay, that's okay. So once you log in, you're going to have this kind of a dashboard. And the good thing is that on the left, you'd see Humanitarian Global Discord channel. So that is where you're supposed to click. And then you're going to see a list of channels here. Mine might be many, but for you, you'd be able to see this one, Humanitarian Global Wave. So that is the channel that you're supposed to join. You can click on it and then be able to see conversations there. So as I said, I'm happy because I can see some of us have managed to create an account, and it's very easy for me and also the team from Humanitarian Global to be chatting to you. And this is a platform that we want you to embrace so that we can support you, Joyce, and also other participants on how we can be part of your success in terms of ensuring that you don't face challenges when it comes to any topic related to humanitarian and also development sector. So with that said, I would like to urge you, continue creating an account, be part of this forum. This is where you can even message and talk to someone from the chat. You could be able to see that we had presenters within the presentation for today. So you can also get to interact with them. Most of us here have been able to implement SBCC programs. We have a lot that we can share. And with Humanitarian Global, it's all about information sharing. So as much as we are training you, we have a lot that we can also learn from you. So through this platform, that is how we can be able to be part of supporting you. And the good thing, I hope you're going to explore more. You can also download an app, install it in your machine, and that would ensure that you can have an easier way for you to even be able to see charts and communication in real time as we continue having this kind of conversation. So this is where, again, we would be able to post the recorded version. As much as we send it to your email, we would also be able to share the recorded version and the slides in this platform so that you can easily access them. So my urge for you, try to sign up, invite as many colleagues and your staff members, your social media network, let them join so that we can all be able to support each other. So we believe in having all the solutions amongst ourselves, and that's why information sharing is very important. And we look forward to having you join us. In case you face any challenge when it comes to creating an account, always feel free to write us an email and then we can support you. So that is it from Humanitarian Global, and we are happy for having been able to attend. I know it's on a weekend, and we really appreciate and acknowledge your urge to be able to learn and continue engaging us so that we can support you. So that is it from Humanitarian Global, and at this moment, I would like to bring it to a close, and we wish you a great afternoon and also a good morning to some of us. And we look forward to interacting more. So I'll be waiting, and we would be waiting to chat to you on the Discord forum. So thank you so much, and bye-bye for now.
Attention humanitarian and development professionals. Are you looking to take your career to the next level? Then you've come to the right place. Humanitarian Global offers self-paced online courses designed specifically for you. With our comprehensive curriculum, you'll build your capacity in the most critical areas of humanitarian and development work. Our course offerings include monitoring, evaluation, accountability and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal, infant and young child nutrition. With Humanitarian Global, you'll have the opportunity to grow your skills and impact the lives of people in need. Visit our website to learn more about our courses and apply today.